Hi, I'm Michael Bailey, the recipient of the Elisse Zack HIV and Rehabilitation Award this year. And I'm very grateful for the award. I didn't think that I was the person who merited this award in the beginning, but it was great to be able to reflect upon the past 30 odd years of my life and involvement with HIV. And I'm of that generation of the first wave of people who were infected with HIV, and I live with HIV and have for over 30 years now. So it allowed me to think back to the beginning, and I had been involved in the care of people who were dying at the time, of people who had gone to university with. And it was very different, and I think the whole movement, and I would say it's a movement, the HIV movement, has changed and is an example for other patient groups, I guess we would call them. And I accepting the award, I had talked about how I'd been involved with an organization in Montreal, and when it became obvious I had HIV because I had Kaposi sarcoma, and it was on my face and it was very quick, and that was like the sign then. The executive director of an organization that's no longer existing asked me to resign as a volunteer of the development of a buddy program, saying it was time for us to take care of you now. And that time for us to take care of you, it meant you were dying. So that wasn't rehabilitation. It was very much, and I realized that these were the times, and it was palliative care. And that's what organizations were offering. But I think that organizations have changed, the work has changed. And after that, the organizations that came out of the HIV movement, their mandates started to involve people who were HIV positive. And it was very much, and it often the mandates went like, we can't do this alone, we need the help of others. So others have always been important, very important, vitally important. But we see that things have changed. I've been very grateful to be involved with Realize, and before Realize Quigger, around HIV and aging. And particularly, it's moving for me that this is the Elisse Zack Award for HIV and Rehabilitation. That Elisse was somebody who saw the future of HIV as a chronic episodic illness, and she saw that rehabilitation in the sense of being the best physically and mentally that you could be. And this was inclusive of healthcare, but in our Canadian context of all of those allied healthcare providers. And Elisse had that kind of personality that attracted people. Her intensity brought people in. And she was able to attract researchers. She was able to attract policymakers too. And I know, being with her and going to conferences, speaking around HIV and aging at gerontology conferences, that she just forced that place in there of attracting young researchers to be doing research on rehabilitation and HIV and aging. So that was, that's really moving for me to be able to also think back to Elisse, to be able to think back to times that were traumatic and trauma, and to think of the people who I've worked with over the years. And in that room accepting the award, there were so many people I knew, And it was very, it was nice to kind of just reflect upon that. The work, it still needs to be done. I know that Realize is probably the only organization that does work around HIV and aging. Our funders, and we're in this funding mode of funding prevention. But there's still a lot of us out there who are looking at aging and need that research. And Quigger finds that, the studies that are being done, and a lot of the information that comes out is very hopeful. I know that there are different groups of people who are aging with HIV, people who had gone for years and years without treatment, like myself, that the outcomes weren't as good as somebody who started treatment right away. And I think that Quigger is an organization that brings that knowledge to other organizations that do the work of HIV, and it's very hopeful. I mean, even a couple of years ago, we would say, that somebody who's aging with HIV, who wasn't on treatment earlier, that their bodies and minds are probably 15 years older than what they would have been. And that's not necessarily true, and it's information that I get from Quigger around that I can take to other people. Realize. I know that I'll owe Tammy a lot of dollars for the number of times I've mentioned Quigger for Realize. But Realize has moved, and I know that Elisse would have been happy with the directions that Quigger Realize is taking. Elisse was one of those people who her enthusiasm was so contagious that she could bring people in, young researchers, policymakers, and that was, I think, what Elisse gave to Realize, and Realize has run with it. Realize is doing great work in the areas of HIV and aging, one of my interests, but also in HIV and mental health, which is very important. Looking at what episodic illness is in reality, and how policies may assist people to keep their jobs and to work. There's still a place for Realize, and it's very important. And the people who work here, I think that Elisse would be very proud that they've taken this up and are carrying on this work.